My name is Joel Spicer, and I'm the president of the Micronutrient Initiative, a global nutrition organization with its headquarters right here in Canada. Now, I'm happy to report that having lived abroad for many years, working with different global health agencies, this opportunity at MI has finally brought me home. And since you're also freshly arrived, let me share 3 things that I had forgotten about Canadians. 1, we're very polite. We invited you and you came. Thank you very much for coming. We really appreciate it. And 2, we care about the world around us and the world we're in. And we have a natural allergy to things that are unjust or unfair. And you can count on us to stand up when those things need to change, the same way we count on many of you. 3, we love hockey. Woo! It's one of those all too rare things we allow ourselves to feel united and unapologetically proud about. You know, a lot of countries feel that way about their sport or other things they do well in the world because it reminds them of what their A game can look like when they bring the best parts of themselves together. You know, people need to be reminded of the best parts of themselves so they know the effort they put in matters, and so they remain focused, determined to stay the course, and committed to fighting smarter and fighting harder until the job is done. And that's why all of you are here, and that's great. So I'm going to talk to you about how critical it is that we put our collective A game together more, how important nutrition is to that A game, and how women and children cannot afford a single missed opportunity. So when people don't have enough vitamins and minerals to develop properly and fight disease, they suffer from micronutrient deficiencies, or what we call hidden hunger. Now, hidden hunger affects 2 billion people in the world today, people who don't get enough iodine, zinc, iron, and vitamin A. You know, for vitamin A alone, roughly 200 million preschool children are vitamin A deficient, and this weakens their immune system, leaving them more vulnerable to infection and disease. Last year, it was linked to more than 160,000 deaths and 500,000 cases of preventable blindness. Now, I want to give you an example of a Canadian A game. Appropriately, it's about vitamin A. So this is a vitamin A capsule. And this little red capsule packs a powerful punch. They've been an important part of child health services in countries around the world for almost 2 decades. This little red capsule represents ingenuity and innovation and would not have been possible without bringing together the best of those represented here. Private sector, NGO, government, United Nations, academics and researchers and foundations, our A game. So 20 years ago, researchers at the University of Toronto, building on Johns Hopkins University studies and others, compiled evidence to show that vitamin A supplements could reduce deaths in children over 6 months by up to 23%. But there was no real commercial market to produce for. So it took the support of the Canadian government, working through the MI, to create a market for these capsules, making a commitment to buy enough from manufacturers to produce the volume needed to make a difference. Effectively, this was an early advance market commitment. So working with private sector manufacturers in Canada, we developed capsules that could survive transport to hot climates, had a shelf life of 3 years, and could be easily administered by frontline health workers. All they had to do is snip the end off the capsule and squeeze the contents into a child's mouth. And as you've heard, each dose costs just 2 cents to make. So today you can find bottles of vitamin A capsules, most stamped with a Canadian flag and an MI logo, on the shelves of health posts and health clinics from Afghanistan to Zimbabwe. Canada supplies 75% of the global need. We have procured 8 billion capsules since we began. And last year, working closely with governments and with key partners like UNICEF and Helen Keller International, we protected more than 150 million children. Now that makes me proud to be Canadian, and proud to be part of an organization and a country that punches above its weight, quietly, politely, and working with so many of you. You know, when MI was launched more than 20 years ago, it was created because Canada realized that to attack the challenge of undernutrition, we had to scale up what we knew would make a difference, adding iodine to salt, fortifying staple foods, and ensuring the vulnerable get nutritional supplements like vitamin A and iron. And as a start, we chose to focus on those interventions that could truly give us the biggest bang for the buck, some of which literally cost only pennies per person. We did everything we could to make sure they got to those people who needed the most. And last year, we reached more than 500 million of them. So as a result, MI has been a contributor, along with so many of you, to the revolution in child survival that has cut deaths in half in a single generation. Now that is a tremendous success. And yet, there's still so much more to be done. You know, last year, 6.3 million children died from mostly preventable causes. And you know how we can cut that in half again? Invest in nutrition, because for almost half of those children, undernutrition is the main underlying cause. Almost half. For the hundreds of millions that don't die, many face catastrophic consequences because of poor nutrition. For example, right now in the world, 50 million children are wasted. That means too thin for their height and in need of emergency feeding. And yet, at the other end of the spectrum, we've got 40 million children that are overweight. So this double burden is emerging. Both of these are related to poor nutrition. And finally, a number that still boggles my mind. Over 162 million children are stunted. That is, permanently damaged, permanently weakened, and unable to reach their full potential for the rest of their lives. Now, stunting is what happens to a child's brain and body when they don't get the kind of nutrients that they need, particularly in the 1,000 days between conception and their second birthday. The damage is irreversible. That child will never learn nor earn as much as they could have if properly nourished early in life. Stunted is really just code for lost potential, lost to the person, lost to their families and communities, and lost to the world. You know, the fight against poverty can never be won while entire generations are malnourished, stunted, and with their development potential impaired for want of good nutrition. They are the innovators of tomorrow. They're the producers of tomorrow, and they're the consumers of tomorrow. They are the Gandhis, Mandelas, and Beethovens of tomorrow. And the fact is, we need them as much as they need us, because without their full potential, all of us lose. That's why this summit, Saving Every Woman, Every Child, has included nutrition as a key component, because simply surviving is not enough. Women and children need to thrive as well. So if we're going to accelerate progress towards the goal of saving every woman and every child, we're going to have to build a truly global A-game. And I'm optimistic, because we're already doing a lot of those right things. We just have to keep breaking down the walls and silos within and between health and nutrition and do more of the right things together. And we have to add as much value as we can to every contact. Now, I want to introduce you to a couple of people to explain what I mean. This is Aida. She's a mom. Moms are the ultimate frontline health workers, and many dads are too. Like all parents, Aida wants a better life for her son, Baye. And that's why she took him to the Child Health Day campaign in Mekke in Senegal. It's there that children like Baye receive bed nets, deworming tablets, vitamin A capsules, growth monitoring, and vaccines when needed. Now, Aida brings Baye because the effort it takes for her to get there has a high return on investment. She gets a bundle of services, not just one. That's why she goes. Now, to further illustrate how intimately connected nutrition and health are to keeping mothers alive and keeping babies healthy, I'd like to introduce you to Jocelyn McCory. Now, Jocelyn is a health worker focused on healthy pregnancies and deliveries. MI supported her training as part of the Mama na Mtoto project in Western Kenya. So in addition to being trained in emergency obstetric procedures, Jocelyn was being trained in delayed cord clamping, because waiting to cut the umbilical cord for only 2 minutes instead of doing it right away provides the newborn an added infusion of iron from their mother that helps see them through those first critical days and weeks of life. And that's about as low cost and sustainable a nutrition intervention as you can get, and that goes for immediate and exclusive breastfeeding as well. And yet, coverage of both is still low. Now, it may seem like a stretch for a nutrition organization to be involved in maternal care, but it's not. Because putting together the full package of health and nutrition interventions, rather than just pieces of it, is critical for ensuring that moms and newborns have the right start in life. In fact, we also have to find every opportunity to impact adolescent girls as well, because many of them will become the mothers of tomorrow, and their health and nutrition status before they get pregnant is fundamental to breaking the cycle. So Jocelyn's is the example of an approach we need to take if we're really going to bring it together for women and children. They are women at the front lines of nutrition and health. They are Sun, the scaling up nutrition movement, which is global, that's been building momentum and political will at a tremendous pace. They're also people that translate this growing political will into action and results on the ground. So I like the stories of Jocelyn and Ida because they're about people at the end of the chain saving lives. Their stories are about how we help people the most when we bring our A game and when we try and maximize the value of every opportunity to make life better. So how do we do more of that is the question. We can do that by recognizing that good nutrition is an absolute prerequisite for human development because it impacts and is impacted by health, education, labor, agriculture, economic development, and other critical areas. You know, you can't learn properly or you can't work productively if you're malnourished. To illustrate that point, according to the African Union, Ethiopia lost $5 billion in 2009 due to child undernutrition alone. That's over 16% of their GDP. That's also one of the reasons why Ethiopia is scaling up nutrition. So if countries are interested in equitable and real economic development, and if donors are interested in maximizing their investments, and if companies are interested in a healthy workforce and opening new markets, we have to invest and recognize nutrition. So when a family, person, or community gets 1 or 2 interventions, when what they really need to make a difference is 4 or 5 brought together, we're not using our resources as effectively as we should. These missed opportunities to add value must be proactively identified, prioritized, and fixed. So when we provide vitamin A capsules every 6 months and we don't harness that platform effectively for deworming and other interventions, that's a missed opportunity. When we successfully treat a child for severe acute malnutrition, only to have them back on treatment again in 6 months because they don't have the ongoing community-based nutrition supports they need, that's a missed opportunity. And when we don't take advantage of social protection or school feeding programs to deliver everything they can for women and children, and in particular for adolescent girls, that's a missed opportunity. Now that being said, there are many inspiring examples of our A game coming together. And here's a couple of them. The Global Fund to fight AIDS, TB, and malaria, and UNICEF just signed an agreement to harness Global Fund delivery platforms and add essential commodities like antibiotics to fight pneumonia, iron for women, and oral rehydration salts with zinc to treat diarrhea in children. Now this is a good way of adding value, bringing communicable disease and maternal, newborn, and child health efforts together. Another way of doing that is when private and public sector come together. And we're very pleased to be working in collaboration with Teck, a leading Canadian mining company, the Government of Canada, and UNICEF on the Zinc Alliance for Child Health, an innovative partnership to scale up zinc and ORS for millions of children around the world. Now we need more of this kind of thinking and better, this kind of action, because every pathway must be seized fully. You know, it's funny how there isn't really any accountability for missed opportunities in global health. Wouldn't it be great if we had a missed opportunities map that could show us where different NGOs and donors and governments in the private sector were delivering different services and interventions, but in a disconnected way? We could use that map to drill down on where the opportunities to add value were, so we could make the strategic investments required to connect them and save lives. You know, we have CEOs, COOs, and CFOs of companies and organizations. Maybe it's time we had Chief Value-Adding Officers, CVOs, of global health organizations, someone whose job it is exclusively to focus on how to add value at every step and how to identify missed opportunities to do so, within health, within nutrition, and between health and nutrition, and beyond to other related sectors as well. These people could influence or direct financing to bridge and connect those missing pieces so we can do a better job of helping people that are falling through the cracks. You know, this is something we can work on together at this summit and something MI is committed to. No more missed opportunities for women and children. You know, I started by talking about this little red capsule. It's symbolic of what has been achieved and what can be achieved when we bring the best of what every sector has to offer and weave it together, adding value for women and children with every stitch. When we do that, that is our collective global A game. Now, there's a saying in Amharic from Ethiopia that I particularly like, and it goes like this: Dir biabir anbesa yasir. And what that means is, if all of us put our nets together, we can even catch a lion. So we're here at this summit to catch a lion. And in this case, the lion is the promise of every child's life lived to its full potential. Thank you very much.